Welcome to MAP Med Textbooks. This is the first video of the breast anatomy series, and in this topic we are going to discuss about the general description of the breast shape and size, basic breast anatomy, the fascial system, submammary space, the axillary tail of Spence, and the pathological and normal variation of the breast. So let's dive into it. The general description. The breast is the secondary sexual feature in females. Say it with me. The breast is the secondary sexual feature in females, and it is a source of nutrition in neonates. Again, it is a source of nutrition for neonates. What is the location of the breast? The breast primarily lies within the superficial fascia of the anterior upper thorax. Say it again. The breast primarily lies within the superficial fascia of the anterior upper thorax, and it extends laterally to variable extent depending on individual variation. Now, what's the general description of breast? It's the secondary sexual feature in females and source of nutrition for neonates, and location where primarily lies within the superficial fascia of the anterior upper thorax, and it extends laterally to variable extent depending on the individual variation. Done. Now the second part, breast shape and size. The shape and size varies by multiple factors. The breast shape and size varies by multiple factors. What are those? Genetic factors, racial background, dietary factors, age, parity, and menopausal status. Now say it with me again. Varies by multiple factors. What are those? Genetic factors, racial background, dietary factors, age, parity, and menopausal status. Now, next part. What are the common shapes? What are the common shapes of the breast? It can be hemispherical, conical, pendulous, piriform, thin, and flattened. Now again, say it with me. It can be hemispherical, conical, pendulous, piriform, thin, and flattened. Now we can move on to the next part. Now we have discussed about the general description. We have discussed about breast shape and size. Now the basic breast anatomy. The base of the breast. Base of the breast. The base of the breast is the attached surface of the breast. Okay, the base of the breast is the attached surface of the breast. It has a vertical extent, and the transverse extent. What's the vertical extent? It is from the second to sixth rib. It moves from second to sixth rib. And the transverse extent from sternal edge medially to the mid-axillary line. From sternal edge medially to the mid-axillary line. Okay, that is order. There are vertical extent, transverse extent. Say it with me. From second to sixth rib, and the transverse extent from the sternal edge medially to the mid-axillary line laterally. Clear? Okay. The next one. Now, what is the superolateral quadrant? What is the superolateral quadrant? This is the prolonged toward the axilla along the inferolateral edge of the pectoralis major. This superolateral quadrant of the breast is prolonged toward the axilla along the inferolateral edge of the pectoralis major muscle. This projects slightly beyond the edge of the pectoralis major muscles. This projects slightly beyond the edge of the pectoralis major muscle. And over there, the axillary tail of Spence extension through the deep fascia up to the apex of axilla. We will be discussing about the axillary tail of Spence later. So the superolateral quadrant, there's the base and there's the superolateral quadrant. It is prolonged toward the axilla along the inferolateral edge of the pectoralis major, and it projects slightly beyond the edge of the pectoralis major muscle. And The axillary tail of Spence, it extends through the deep fascia up to apex of axilla, Now the fascial system. We have discussed about the general description, breast shape and size, and the basic anatomy. And the fourth part is the fascial system. There is superficial fascial system, there's a deep pectoral fascia, and inframammary crease. The superficial fascial system, it splits to enclose the breast and forms the anterior and posterior lamellae. Superficial fascial system splits to enclose the breast and forms the anterior and posterior lamellae. It covers the breast. The superficial fascial system covers the breast. And the posterior extensions of the superficial fascia connects the breast to the pectoral fascia, which is a part of the deep fascia. So the posterior extension, which covers the breast, connects the breast to the pectoral fascia. Say it again with me. Superficial fascial system splits to enclose the breast and forms the anterior and posterior lamellae. The posterior extension of the posterior extension of the superficial fascia connects the breast to the pectoral fascia, which is a part of the deep fascia. Now, what is this inframammary crease? Inframammary crease, a zone where the superficial fascia adheres to the underlying chest wall. A zone where the superficial fascia adheres to the underlying chest wall, which forms crescent-shaped lower border. That's how the crescent shape of the lower border of the breast happens. Then the deep pectoral fascia, the last part of the fascial system. We discussed about superficial fascial system. We discussed about inframammary crease, and now we are discussing about deep pectoral fascia. This deep pectoral fascia, the breast rests on this fascia. That's where the resting place of the breast is. That's the deep pectoral fascia. And it covers the pectoralis major, serratus anterior, and the external oblique muscles aponeurosis. It covers what? It covers pectoralis major, it covers serratus anterior, it covers external oblique aponeurosis. What is that aponeurosis? That is the rectus sheath. The next part of it, the external oblique aponeurosis forms the part of the anterior wall of the rectus sheath. Now there are 3 points for the deep pectoral fascia that you have to remember regarding the breast. First one, the breast rests on the fascia. It covers the pectoralis major and the serratus anterior and the external oblique aponeurosis. And what is this external oblique aponeurosis? It forms the part of the anterior wall of the rectus sheath. Right. We'll move on to the next one. We have discussed about general description, breast shape and size, breast anatomy, and the fascial system. Now, the submammary space. It is located between the breast and the deep pectoral fascia. Say it with me. Located between the breast and the deep pectoral fascia. And it is composed of loose connective tissue. And it allows the breast some degree of mobility over the deep fascia. As you can see here, it helps you to move the mobility. It helps the mobility. Now, the submammary space, what is it? It is located between the breast and the deep pectoral fascia, and it is composed of loose connective tissue, and it allows the breast for some degree of mobility over the deep fascia of the pectoralis major muscle. Okay, now the next point. Axillary tail of Spence. As we have told before, the superolateral quadrant extends toward the axilla via the inferolateral edge of the pectoralis major muscles. The superolateral quadrant of the breast extends towards the axilla via the inferolateral edge of the pectoralis major muscle. This axillary tail of Spence projects through the deep fascia towards the apex of axilla. What you have to remember about axillary tail of Spence, the superolateral quadrant extends towards the axilla via the inferolateral edge of the pectoralis major muscles. The axillary tail of Spence projects through the deep fascia towards the apex of axilla. Now, What are the pathological and normal variations? What are the pathological and normal variations? In advanced mammary carcinoma, it can cause tethering or fixation of the breast to the underlying musculature. Why? Due to the fibrosis or invasion of the cancer cells into the surrounding tissues. In advanced mammary carcinoma, it may cause tethering or fixation of the breast to the underlying musculature due to fibrosis or invasion of the cancer cells into the surrounding tissue. So, what about the normal projections? Occasionally, small projections of glandular tissue can pass through the deep fascia into the underlying muscle, even in normal subjects. So there are normal projections and there can be advanced mammary carcinoma. These small projections are what? They are glandular tissue which can pass through the deep fascia into the underlying muscle, even in normal subjects. Now guys, we have covered the very basic anatomy of breast. This is just the first part, and there will be other videos. Thank you very much for listening.